I became an OBGYN specialist because, well, first of all, I always liked working with my hands, and I wanted to do something surgical where I can always be using my hands to help the patients out. It wasn't until my third year of residency when I did a rotation in infertility at the Cleveland Clinic where I fell in love with OBGYN. There I saw patients who were struggling to have families and to achieve a pregnancy, and I saw what joy the physicians were able to bring to their lives, helping them conceive and start their family. And that's when I fell in love with OBGYN and pursued that career. It's extremely important for women to visit their OBGYN on an annual basis. First of all, it is one of the few specialties where we can actually prevent a certain kind of cancer. Cervical cancer can be potentially very deadly, and women who get yearly pap smears to check for cervical cancer rarely get cervical cancer because we're able to detect the abnormal cells long before they turn into cancer cells. Also, it's important to visit regularly to make sure they have a physician do a breast exam and a pelvic exam, and make sure there's no lumps or any pathology going on that they would not otherwise know about, because a lot of things are not symptomatic, and if they don't go to the doctor regularly, they would never know they had the problem. The robotic hysterectomy offers several advantages to the patient over a traditional hysterectomy. First of all, it allows us to do very difficult hysterectomy cases through just a few very tiny incisions in the abdomen. And this results in much less blood loss to the patient, much less pain after the surgery, and a much quicker recovery time and less risk for infection. The number one reason why patients are selecting the robotic hysterectomy is because in this day of age, where a lot of women are working or taking care of their children, it is very important for them to be able to get back to work or to their family as quickly as possible. And with the robotic hysterectomy, they can get back to their normal activities in as little as 2 weeks, compared to about 6 to 8 weeks if they have a traditional hysterectomy. Other minimally invasive procedures I offer with the Da Vinci robotic system is a procedure called a myomectomy, which is a procedure that removes fibroids from the woman's uterus. It's for women who have problems with heavy periods related to the fibroids, or they're having trouble conceiving a pregnancy because of the fibroids. So this allows a minimally invasive approach, and again, a quicker recovery, less blood loss, and less pain afterwards. One other minimally invasive surgery that I do, in addition to the robotic surgery, is something called an endometrial ablation procedure, where we burn the woman's lining of her uterus, which significantly decreases the amount of bleeding she has with her periods, and a good proportion of women don't even have any periods anymore after they've had this type of procedure. It's an excellent alternative to a hysterectomy if bleeding is their only problem. If a patient chooses me as their physician, they can expect a physician that's calm and will sit down with the patient and listen to all of their problems, and don't make the patient feel rushed through the office visit. I will not leave the room until their questions are answered satisfactorily and they understand everything that's going on with their health that I can help them with. My philosophy towards practicing medicine is to do the most minimally invasive approach to take care of a woman's problem. My overall philosophy is to do no harm, and that falls in the lines of just doing things with the least invasive approach to help the patients as much as possible. Also, I try to involve as much as possible the patients in their medical decision-making process. I present the patient with all the facts of what's going on with their health, and I go over all the different options that are available to help them, and then I ask them which one of these options appeal to you to start with to see what will help you first. When patients come to my office, they can expect a very friendly and courteous office staff. My office staff goes out of their way to make sure patients feel very comfortable. This is a notoriously very uncomfortable experience for a patient when they have to come in for a female exam. So it's very important for the staff to make them feel as much at ease as possible to get them through this potentially unpleasant experience.